Welcome dear student in my course named Determinant of Quality of Life. Today we will discuss on the topic HIV/AIDS and its prevention. Content of this module is HIV and India, Introduction HIV, Introduction of AIDS, HIV symptoms, AIDS symptoms, HIV transmission, transmission myth, prevention of HIV infections, treatment of HIV, HIV test, HIV testing, test confidentiality, and final tips and takeaway. Learning outcomes of this module is, at the end of this module, student will be able to recall key fact about HIV and its prevalence in India. Student will be able to identify symptoms of HIV and AIDS. Student will be able to list the methods used for HIV testing. Student will be able to explain the differences between HIV and AIDS. Student will be able to discuss myths related to HIV transmission. Student will be able to demonstrate how to educate others on preventing HIV infection. Student will be able to apply knowledge of symptoms and transmission to assess risk in various scenarios. Student will be able to compare and contrast the symptoms of HIV and AIDS. Student will be able to analyze the effectiveness of current HIV treatment method. Student will be able to distinguish between scientifically accurate information and myths about HIV transmission. Student will be able to evaluate the reliability of various HIV testing methods. Student will be able to judge the importance of confidentiality in HIV testing and its impact on public health trust. Student will be able to assess national strategies used to combat HIV in India. Student will be able to design a community awareness campaign on HIV prevention and testing. Student will be able to develop educational material to dispel myth and misinformation about HIV. HIV and India. Prevalence in India of HIV. Adult HIV prevalence is 0.2%. People living with HIV is over 2.4 million people living with HIV in India, the third largest in the world. National AIDS Control Organization August 2022 report. New infection in India. Annual new HIV infection are estimated at 66,400, a 44% reduction since 2010. Stigma about HIV is less than 10% of people living with HIV, and key population experiences stigma and discrimination. Regional disparity for HIV is southern states like Maharashtra, Andhra Pradesh, and Karnataka have the highest number of people living with HIV. Northeastern states like Mizoram, Nagaland, and Manipur also have higher prevalence rate. Report on 2021. Routes of transmission. Unprotected sex, that is the 80% heterosexual, is the major route of HIV transmission. Transmission from parents to child and unknown causes also contribute. ART-SS, that is the antiretroviral therapy. While India has a large number of people living with HIV, efforts are ongoing to increase access to antiretroviral therapy, that is the ART. Historical trends of HIV is HIV prevalence has generally declined in India with a 34% decline from 0.32% in 2010 to 0.21% in 2021. New infections have also decreased by 46% about 2010 to 2021. What is the HIV? Introduction of HIV. HIV stands for Human Immunodeficiency Virus. HIV is a retrovirus that infects cells of the human immune system, mainly CD4 positive T cell and macrophages, key component of the cellular immune system, and destroy or impair their function. HIV is a retrovirus that infects cells of the human immune system, mainly CD4 positive T cell and macrophages, key component of the cellular immune system, and destroy or impair their functions. Infection with this virus result in the progressive depletion of the immune system, leading to immunodeficiency. The immune system is considered deficient when it can no longer fulfill its role of fighting off infection and diseases. People with immunodeficiency are much more vulnerable to a wide range of infections and cancers, most of which are rare among people without immunodeficiency. Diseases associated with severe immunodeficiency are known as opportunistic infections because they take advantages of weakened immune system. Introduction of AIDS. AIDS stands for Acquired Immunodeficiency Syndrome and describes the collection of symptoms and infection associated with acquired deficiency of the immune system. Infection with HIV has been established as underlying cause of AIDS. The level of immunodeficiency or the appearance of certain infections are used as indicators the HIV infection has progressed to AIDS. The term AIDS applied to the most advanced stages of HIV infection. The majority of people infected with HIV, if not treated, develop signs of AIDS within 8 to 10 years. The length of time can vary widely between individuals. The time between infection with HIV and becoming ill with AIDS can be 10 to 15 years, sometimes longer, but sometimes shorter. Antiretroviral therapy can prevent progression to the AIDS by decreasing viral load in an infected bodies. What is the HIV symptoms? Most people infected with HIV do not know that they have become infected. Immediately after the infection, some people have a glandular fever-like illness with fever, rash, joint pain, and enlarged lymph node, which can occur at the time of seroconversion. Seroconversion refers to the development of antibodies to HIV and usually take place between 1 and 2 months after an infection has occurred. Despite the fact that HIV infection often does not cause any symptoms, a person newly infected with HIV is infectious and can transmit the virus to another person. The way to determine whether HIV infection has occurred is by taking an HIV test. HIV infection causes a gradual depletion and weakening of the immune system. Its result is an increased susceptibility of the body to infection and cancers and can lead to the development of AIDS. AIDS symptoms. AIDS is identified on the basis of certain infections. Stage 1 HIV disease is asymptomatic and not categorized as AIDS. Stage 2 include minor mucocutaneous manifestation and recurrent upper respiratory tract infections. Stage 3 include unexplained chronic diarrhea for longer than a month, severe bacterial infection, and pulmonary tuberculosis. Stage 4 includes toxoplasmosis of the brain, candidiasis of esophagus, trachea, bronchi or lungs, and Kaposi sarcoma. Most of these conditions are opportunistic infections that can be treated easily in healthy people. AIDS on the basis of the CD4 positive T cell count of cell less than 200 per millimeter cubic of blood in USA report. CD4 positive T cells are critical in mounting an effective immune response to infection. HIV transmission by sexual transmission. HIV can be transmitted through penetrative sex. HIV is not transmitted very efficiently, so the risk of infection through a single act of vaginal sex is low. Transmission through anal sex has been reported to be 10 times higher than by vaginal sex. A person with an untreated sexually transmitted infections, particularly involving ulcer or discharge, is on average 6 to 10 times more likely to pass on the acquired HIV during sex. Oral sex is regarded as a low-risk sexual activity in terms of HIV transmission. When a person living with HIV is taking effective antiretroviral therapy and has a suppressed viral load, they are no longer infectious. Having sex with someone living with HIV is safe if the person's virus is fully suppressed by treatment. Sex is also safe if a condom is used properly or if you are taking pre-exposure prophylaxis in accordance with your healthcare provider recommendation. It is best for someone living with HIV to avoid becoming infected with a different strain of the virus. HIV transmission through sharing of needles and syringe. Reusing or sharing needles or syringe represents a highly efficient way of transmitting HIV. The risk of transmission can be lowered sustainably among people who inject drugs by always using new needles and syringes that are disposable or by properly sterilized reusable needles syringe before reuse. Transmission in a healthcare setting can be lowered by healthcare workers adhering to universal precautions. HIV transmission through mother to child transmission. HIV can be transmitted to an infant during pregnancy, labor, delivery, and breastfeeding. Generally, there is a 15 to 30% risk of transmission from mother to child before and during delivery. A number of factors influence the risk of infections, particularly the viral load of mother at birth. The higher the load, the higher the risk. Transmission from mother to child after birth can also occur through breastfeeding. The chances of transmission of HIV to the child is very low if the mother is on antiretroviral therapy during pregnancy and when breastfeeding. Transmission through blood transfusion. There is a high risk, greater than 90%, of acquiring HIV through transfusion of infected blood and blood products. However, the implementation of blood safety standards ensures the provision of safe, adequate, and good quality blood and blood product for all patients requiring transfusion. Blood safety includes screening of all donated blood for HIV and other blood-borne pathogens, as well as appropriate donor selection. Transmission through body piercing or tattooing. A risk of HIV transmission does exist if contaminated instruments are either not sterilized or shared with others. Instruments that are intended to penetrate the skin should be used once, then disposed or thoroughly cleaned and sterilized. Transmission through sharing razor with an infected person. Any kind of cut using an unsterilized object such as razor or knife can transmit HIV. Sharing razor is not advisable unless they are fully sterilized after each use. No transmission through kissing or deep kissing. Transmission through kissing on the mouth carries no risk, and no evidence has been found that the virus is spread through saliva by kissing. Transmission myth. Now we discuss the transmission myth about HIV/AIDS. HIV is not spread by mosquitoes or other biting insects. Even if the virus enters a mosquito or another sucking or biting insects, it cannot reproduce in the insect. Since the insect cannot be infected with HIV, it cannot transmit HIV to the next human it feeds on or bite. There is no evidence that HIV can be transmitted while playing a sport. HIV is not transmitted by day-to-day contact in social setting, schools, or the workplace. You cannot be infected by shaking someone's hands, by hugging someone's, by using the same toilet, or drinking from the same glass, or someone living with HIV, or by being exposed to coughing or sneezing by the infected person. Does HIV only affect homosexual and drug users? No. A person infected with HIV may look healthy and feel good, but they can still pass the virus to you. An HIV test is the only way a person can find out if he or she is infected with HIV. Person can have more than one sexually transmitted infection at the same time. Each infection requires its own treatment. You cannot become immune to sexual transmitted infections. You can catch the same infection over and over again. Many men and women do not see or feel any early symptoms when they first become infected with a sexually transmitted infections. However, they can still infect their sexual partner. Prevention of HIV infection. Prevention of sexual transmission. Monogamous relation between uninfected partner. Non-penetrative sex. Consistent and correct use of male or female condom. Sex between two people when one of them is living with HIV but in taking antiretroviral therapy and has undetectable viral load. Pre-exposure prophylaxis taken by people who are not infected with HIV. Voluntary medical male circumcision reduces the chances of men acquiring HIV from women. Additional way of avoiding infection. Ensure that blood and blood products are tested for HIV and that blood safety standards are implemented. If you are an injecting drug user, always use new needles and syringes that are disposable or needles and syringes that have been properly sterilized before you use. Never reuse or share syringe, water or drug preparation equipment. Using a fresh alcohol swab, clean the injection site prior to injection. Prevention of mother to child transmission. Transmission of HIV from a mother living with HIV to her baby can occur during pregnancy, during labor, or after delivery through breastfeeding. In the absence of any intervention, an estimated 50 to 30% of mothers living with HIV will transmit the infection during pregnancy or delivery. Breastfeeding increases the risk of transmission by 10 to 15%. This risk depends on clinical factor and may vary according to the pattern and duration of breastfeeding. Great progress have been made to reducing the number of children born with HIV. The risk of women living with HIV passing the virus on her child can be reduced to 5% or less with effective antiretroviral therapy during pregnancy, delivery, and breastfeeding. Primary prevention of new HIV infection among women of childbearing age, coupled with early access to prenatal care and HIV testing, are key to the strategy. With women living with HIV also encouraged to remain on lifelong treatment for their own health. Early infant diagnosis is essential to identify the HIV status of infants and to improve prevention and treatment programs as peak mortality occurs between 6 weeks to 4 months of age of children who have acquired HIV infection. Prevention of transmission of healthcare setting as a universal precaution. Healthcare workers should follow universal precaution. Universal precaution are infection control guidelines developed to protect health workers and their patients from exposure to disease spread by blood and certain body fluids. Universal precautions are careful handling and disposal of sharp items that could cause cut or puncture wounds, including needles, hypodermic needles, scalpels, and other blades, knife, infusion sets, broken glass, and nails. Hand washing with soap and water before and after procedure. Use of protective barriers such as gloves, gowns, aprons, masks, and goggles when in direct contact with blood and other body fluids. Safe disposal of waste contaminated with blood or other body fluids. Proper disinfection of instrument and other contaminated equipment. Proper handling of soiled, then linen. Other precautions are all healthcare workers must take precautions to prevent injuries caused by needles, scalpel, and other sharp instrument or devices. In accordance with universal precaution, blood and other body fluid from all people are considered as infected with HIV and other possible viruses, regardless of the known or supposed status of the person. Treatment of HIV. There is no cure for HIV. However, there is an effective treatment, which if started promptly and taken regularly result in quality and length of life for someone living with HIV that is similar to that expected in the absence of infections. Antiretroviral medicines are used in the treatment of HIV infection. They work against HIV infections by blocking the reproduction of HIV in the body. When a person living with HIV is on effective antiretroviral therapy, they are no longer infectious. Inside an infected cell, HIV produces new copies of itself, which can then go on to infect other healthy cells within the body. The more cell HIV infect, the greater its impact on the immune system. Immunodeficiency. Antiretroviral medicines slow down the replication and therefore the spread of the virus within the body by interfering with its replication process in different ways. The use of antiretroviral medicines in a combination of three medicines has been shown to dramatically reduce AIDS-related illness and death. Combination therapy. By antiretroviral treatment to be effective for a long time, different antiretroviral medicines need to be combined. Antiretroviral medicine should only be taken as prescribed by the healthcare professionals. HIV test. An HIV test is a test that reveals whether a person has been infected with HIV. Commonly used HIV tests detect the antibodies produced by the immune system in response to HIV, as they are much easier and cheaper to detect than the virus itself. Antibodies are produced by immune system in response to an infection. For most people, it takes a month for these antibodies to develop. Antibodies can be found in blood or oral fluid. Generally, it is recommended that you wait 3 months after possible exposure before being tested for HIV. Although HIV antibody tests are very sensitive, there is a window period of up to 2 months depending on the specific test being used, which is the period between infection with HIV and appearance of detectable antibodies to the virus. In case of the most sensitive anti-HIV test currently recommended, the window period is about 3 weeks. This period may be longer if less sensitive tests are used. During the window period, people infected with HIV have no antibodies in their blood that can be detected by HIV test. However, the person may already have high level of HIV in the body fluids such as blood, semen, vaginal fluids and breast milk. HIV can be passed on the another person during the window period even though an HIV test may not show that they are infected with HIV. HIV testing. Knowing your HIV status has 2 viral benefits. If you are HIV infected, you can start treatment promptly, thereby potentially prolonging your life for many years. If you know you are infected, you can take all the necessary precautions to prevent the spread of HIV to others. If you are not infected with HIV, you can learn how to protect yourself from HIV in future. Place of testing in the offices of the private doctor, a local health department, hospital, family planning clinic, and sites specifically set up for HIV testing. Always try to find testing at a place where counseling is provided about HIV. HIV test is privacy by using an HIV self-test kit. However, you should go and see your healthcare provider in the event of the positive test result for confirmation and seeking appropriate treatment. All people taking an HIV test must give informed consent prior to testing. Negative test report, there is still a possibility of being infected since it can take up to 3 months for their immune system to produce enough antibodies to show infection in blood test. It is advisable to be retested at a later date and to take appropriate precautions. In the meantime, during the window period, a person is highly infectious and should therefore take measures to prevent any possible treatment. Test confidentiality. The result of the test must be kept absolutely confidential. Confidential HIV test. The medical professional handling the HIV test keep the result of the test confidential within the medical records. Result cannot be shared with another individuals unless written permission is provided by the person tested. Anonymous HIV test. The tested person's name is not used in connection with the test. Instead, a code or number is assigned to the test, which allow the individual being tested to receive the result of the test. No records are kept that would link the person to the test. Shared confidentiality is encouraged and referred to confidentiality that is shared with others who might include family members, loved others, caregivers, and trusted friends. However, care should be taken when revealing the result as it can lead to discrimination in healthcare and professional and social setting. Shared confidentiality is therefore at the discretion of person who will be tested. Although the result of the HIV test should be kept confidential, other professionals such as counselor and health and the social services worker might also need to be aware of the person's HIV positive status in order to provide appropriate care. Thanks to new treatment, people living with HIV can now live long, healthy lives. It is very important to make sure you have a doctor who knows how to treat HIV. A healthcare professional or trained HIV counselor can provide counseling and help you to find an appropriate doctor. Monitoring of the suppression of the viral load is recommended as part of ongoing care for people living with HIV. Final tips and takeaway. HIV in India. HIV, human immunodeficiency virus, is a significant health concern in India, with a notable impact on public health and socio-economic factor. India has the third largest HIV epidemic globally, with high prevalence in certain states and specific population. HIV is a virus that attacks the body immune system, specifically the CD4 cell, T cell, which help the immune system fight off infection. If left untreated, HIV reduces the number of these cells, making the body more susceptible to infection and certain cancer. Introduction to AIDS. AIDS, acquired immunodeficiency syndrome, is the most advanced stage of HIV infection. It is characterized by severe damage to the immune system, leading to the opportunities, infections, and certain cancers. HIV symptoms. Initial symptoms of HIV may include fever, headache, sore throat, swollen lymph nodes, and rash. These symptoms can resemble those of other illness, so testing is essential for the diagnosis. AIDS symptoms. As HIV progresses to AIDS, symptoms worsen and may include recurrent infections, weight loss, diarrhea, and neurological problems. HIV transmission. HIV is transmitted through contact with certain body fluids from an infected person, such as blood, semen, vaginal fluids, rectal fluids, and breast milk. Transmission can occur through unprotected sexual contact, sharing needles, or from mother to child during childbirth or breastfeeding. Transmission myth. There are myths about HIV transmission, such as casual contact, kissing, sharing utensils, or mosquito bites, which are not true. HIV cannot survive outside the body long enough or replicate in insect to be transmitted this way. Prevention of HIV infection. Prevention includes practicing safe sex, using condom, avoiding sharing needles, and using precaution in healthcare setting. Pre-exposure prophylaxis can also reduce the risk of HIV infection in high-risk individuals. Treatment of HIV. Antiretroviral therapy (ART) is the primary treatment of HIV. ART helps control the virus, allowing people with HIV to live longer, healthier lives. It also reduces the risk of transmitting HIV to others. HIV test. HIV testing involves detecting antibodies to the virus or the virus itself in blood, saliva, or urine. Early diagnosis allows for early treatment and better health outcomes. HIV testing. Regular testing is important, especially for those at higher risk of HIV, to ensure early detection and timely treatments. Test confidentiality. HIV testing is confidential, meaning results and shared only with authorized healthcare providers and cannot be disclosed without the individual's permissions, ensuring privacy and confidentiality. Understanding these aspects help in raising awareness, promoting prevention, and improving care and support for those affected by HIV/AIDS. Thank you.